steady rise in
This
COVID
pandemic
cases
is
since reopening just
finally torn back to the
Hello and welcome to Our Virus, a limited podcast series about the coronavirus from an ex-Heimische perspective. My name is Luza Twersky, and I am the man speaking right now.
And I'm Malky Goldman, and I'm the lady speaking right now.
Oh, huh.
Yeah, that was me.
I was wondering who you were.
Yeah, it was me right there.
Hashtag the more you know. Yeah, who are we talking to today, Malky? Who are we going to talk to today?
We're going to talk to Dr. Volvi Fleischman, as they call him, the Goyim.
Actually known as
Dr. Will Fleischman.
There you go.
That's how the fancy people call him.
That's how that's how the people who don't know what humble beginnings he comes from call him.
Yeah, exactly.
Volvi, as he will tell you, it comes from my background. He is an ER doctor in New Jersey, and he will tell you all about that. And without further ado, here's our chat with Dr. Volvi Fleischman. We have Dr. Will, or as we know him, Volvi Fleischman, who is on here today. Volvi.
Yes, hi, Loser.
Hello. Let's get your OTD cred out of the way and tell us where you're from.
Sure, thanks, Loser. I grew up in Borough Park, Brooklyn, and attended Satma Yeshiva and Chayde, or Chayde and Yeshiva, if you're going chronologically. And then, well, I guess that's enough for my street cred.
Yeah, that's basically.
if we're just establishing that.
Yeah. It's like, hey, listen, I went to Satma. What else do you need to know? You know?
And the end.
Yeah. So what happened after you left Satma Yeshiva or whatever, and to tell us about your educational path and where you ended up?
Well, I had an interest in medicine, and to be frank, actually, it partly from admiring the work of the Hatzula volunteers in the community. I ended up going to college, then medical school. I did a residency in emergency medicine, and then I did a fellowship in research. I then worked for the Medicare agency, CMS, for a few years.
Yeah.
And I now work for a health system in New Jersey, where I do both work on improving the quality of care and patient safety, as well as clinical work in the emergency departments of a couple of our hospitals in the system.
Right. So for the lay people, you're a doctor.
Yes.
Yeah.
An emergency physician, to be precise.
Right. That's the gist of it. Is I'm a medical doctor. You're
a doctor.
Yeah, I'm a doctor. So tell me, when did you first hear about this COVID-19 novel coronavirus? Like, where was the medical community? You as a doctor, where were you, both in your knowledge and physically, and like, how did it happen? How did you first hear about this?
Well, I think I don't know if we were actually very different in terms of the general medical community. I don't know if we were very different from the larger country, the country at large. Most of us watched it or followed what was going on in China.
Yeah.
And at first, most of us kind of filed it away. And well, I'll speak for myself, but I think it's true for most of both physicians, but also health experts and public health experts in general. And you know this by seeing what happened and the fact that we didn't prepare as well as we should have. Most of us watched it with interest, but we filed it in the category of, well, we've seen this before. It happened with MERS. It happened with SARS. Yeah, it affected us. MERS, we saw a few cases. With SARS, actually, we saw a few cases. With H1N1, we saw a bunch of cases, and thousands of Americans ended up dying. But it still was something that largely affected other countries, especially China. China has 1 billion people. Sure, it'll spread there fast, but it's not really going to come here. It's not going to cause huge troubles here. That's, I think, the folder that most of us file this away in.
Yeah.
From a medical perspective, oh yeah, very interesting. A new type of thing. Some very interesting things we're seeing in China. Different types of presentations. What's happening with the patients. So that was that. What really, I think, started putting people on notice is when it spread in Italy, and when we had the outbreak and the horrific scenes we saw in Italian hospitals.
Yeah.
I think that's what woke most of us up. But still, we obviously, looking back and seeing how ill prepared we were, both as a country, but individually, health systems, regional public health officials, regional politicians, regional health systems, and hospitals.
Yeah.
We still didn't prepare enough, and I think it goes back to we really didn't think it could hit us,
Right. Do you think?
or at least we didn't think it could hit us like it hit others.
Right. Do you think we were cocky in that way?
I don't think it's cockiness. I think it's simply when it hasn't happened in 100 years, when something hasn't happened in 100 years, you simply forget. You lose the sense of urgency. It's I guess you could almost compare it to hurricane preparation. And
Right.
when you get a hurricane every year, fine. But when you don't have a big one, when you don't have a Katrina every 5 years, you're not going to be prepared for the Katrina when it comes. And this is true with what happened here. And in that sense, you understand why the complacency happened and why we weren't prepared. Not an excuse, but you understand it.
Yeah. So I want to go back and disclose to the audience. I mean, well, obviously we've known each other for a very long time, for probably like 12, 13 years or something. And when this whole thing started, I got sick, or at least I thought I was, and I called you obviously because you're my doctor friend, and that it's what doctors are for and it's what friends are for. That's what you told me, not my words, your words.
Yes.
So when I first called you, how much did we know at the time about the virus? I called you to complain about my breathing. I mean, I'm obviously a smoker. We all know that. We're not going to get into that. But how much did we know at the time about the disease caused by the coronavirus?
Well, we knew what was coming out of China and Italy. That was the extent of what we knew, and we're of course finding out things every day.
Right.
What you described to me, which was having a flu-like illness, is a very vague description of illness, which is actually both can be any kind of cold virus, flu, and so on, but of course could also be a COVID syndrome as well, COVID symptoms as well. But it's impossible. The only way it's essentially impossible to tell them apart. The only way to tell them apart is by doing testing. And back then, which was in early March, this country was not doing any kind of test. I mean, we were doing one-off tests in the CDC laboratory. It was a joke.
Right.
And of course, that's not to get into that, but or maybe we'll get into that later. That's of course the original sin of this whole pandemic. This, at least in our country, that we were just woefully prepared to be able to test people. So, in terms of when you told me, oh, I had a flu-like illness, and now I'm having still some trouble breathing and so on. I think my advice to you, and I was just reviewing what we wrote to each other back then, was that probably not related. But honestly, if I was to reconsider it, I could say it's entirely likely that was longer term sequelae or longer term effects from having a COVID infection, which I'm actually now seeing in the emergency department more and more. People coming in who had COVID a few months ago. Usually in the few weeks following, but sometimes even a month or two later, and they're still having symptoms because of the effects that we're learning this virus has.
Yeah, so that's why I'm asking that question, because it's so fascinating to me that back then, I mean, not only did I know nothing because I'm not a doctor, but also there was a lot that you didn't know as a doctor, as an ER doctor, there wasn't. What I'm understanding is that you didn't have much to tell me either at the time. And I remember that again, I don't remember the exact date it was. You probably, well, you have the text open, so you might know better when it was. And I think at the time there were these doctors from Colombia who were saying that people with severe COVID-19 symptoms, that their CAT scans were showing a very unique kind of inflammation in the lungs. And they were arguing at the time that instead of doing testing, this would be another way to tell if someone who is sick from something else or from coronavirus. You remember that? Do you know anything about that?
Right. So this was, you had texted me in early March, about March 9th or 10th, and that was one of the earlier things that came out of China. One of the earlier reports that came out of China was indeed that the findings on CT scans of the lungs of patients with coronavirus, and back in March, we had about early March, I think March 3rd, we had about 100 cases in the US. But the majority of data came out of China, and they did notice that. And in China, they actually undertook a massive scanning effort to help identify patients with coronavirus. And they would actually have, in one of the papers, they described the process where they had a drive-through CAT scan process where people would just drive up, get out of the car, get on the CT scanner, get scanned and tested, and next.
Wow, crazy.
Which is an incredible thing, and couldn't really be done on the fly, and it would never be able to be set up in the US like that. Nor is it if you, it may not be that useful anyway. But
Right.
In any case, what's incredible is the extent of damage that you see on CAT scan that this virus does to some patients. And very, very much unlike most certainly other coronaviruses, but even something like the flu, which occasionally will do it, but certainly not the numbers that would do the percentage of patients with coronavirus that it would do this to. And also, it did have a somewhat of a hallmark, the way it came up on CAT scan. So yes,
Yeah.
you would ask me whether you should have a CAT scan, I think.
Yeah. I ended up not being able to get one, but it doesn't matter because I became, I got well and I'm fine now, and I got tested a couple of weeks ago and it came back negative. So I guess I might never know if I had it or not, and now I'm hearing that a lot of the tests are a lot of false negatives. It's not that reliable. So well, what matters is that I'm fine, and I guess maybe I had it, maybe I didn't. But what's interesting to me, and the reason I asked that question is that was like on March 9th, and now we're on like May 16th when we're recording this, and if someone came to you now with the same complaints and symptoms as I had at the time, how would you treat that differently?
Well, the first thing we would suspect, of course, is that this is indeed coronavirus. And this is especially true now, not just because, of course, we had such tremendous spread in the country, but also because the flu season has pretty much died down,
Right.
which means that cases like, flu-like illness that present like that would invariably more likely be coronavirus than it would be the flu.
Right.
And I can tell you, there were days in the emergency department in last month where that is all I saw. I literally would see patient after patient with coronavirus-like symptoms, and if I had tested all of them, they probably 80 to 90% of them would be positive, and the rest would not be positive, not because they were not having coronavirus, but because the test simply doesn't pick up all the cases.
Right.
And I wouldn't see any other type of patient, which is an incredible thing, because if 5 months ago I spent a shift in the emergency department, 8 to 12 hours, I would see anywhere from 15 to 25 to 30 patients, and maybe a couple of them had something like maybe 2 to 3 of them, or during the flu season, maybe 5 of them would have flu-like symptoms, cold-like symptoms, and the rest of them would have all kinds of other problems. And suddenly, nobody had these problems, and everything was just COVID, 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 which
Right.
is
So
just something incredible that happened to the medical system in the last couple of months.
yeah, but I mean, I don't want to get into that now. Maybe we'll talk about it later. But I think there is a theory that a lot of people who need to be in the hospital and should probably go see their doctors are not doing that out of fear of getting the coronavirus, or out of this belief that the hospital is not able to handle them because they're overwhelmed, and some people are dying, because of that.
Yes, we can get into it, but the short message there should simply be: if you're having things that would have symptoms, if you're having something that would have previously made you think or made you go to the emergency department, you should still do that.
Yeah.
If you're having chest pain, shortness of breath, and so on, don't hold back from going, because there are a lot of people dying from other things at home, and in many of those cases, it might have been avoided had they simply done what they would have done 2 months ago, which is go to
Right.
the hospital.
All right. So so let's talk about the well, my next question was going to be about cures and about treatment, but before that is I want to ask you about so what are the symptoms? Like, so when should someone start getting worried, or like, maybe I know, like, I'm right now in LA, so like in LA there's like testing, from here to Canarsie. I don't know what's going on in New York, and I don't know what's going on in other places where people listen to this. But I know that if I had to get tested, I can get tested. But in places where like testing is not as widespread yet, what are the symptoms that would make someone think like I should probably get tested? Based on what we know now. Obviously, there's a lot of information still coming in. Yeah.
Mm-hmm. So the symptoms are cough, shortness of breath, having trouble breathing, fever, chills, muscle soreness or pain, sore throat, nasal congestion, loss of taste or sense of smell. But you can also have other symptoms as well. So those are the most common symptoms. You could also have nausea, vomiting, diarrhea. So GI symptoms can also be an only presentation, so an only symptom sometimes of COVID.
Testing, right?
Those would be the basic symptoms.
How many of the symptoms though has to be combined? Because you could have some of them, What would you
It can be
say?
any and all.
Right.
There's really, so, you can say one of this and two of that, but really you could have people who only have a loss of sense of smell, only have some chills, only have this, and that would be the presentation of the virus. The virus affects people very differently, and this is actually true with other viruses as well. People who have the flu, people who have colds, can react very differently to the virus. We don't understand why. It's possible that some of it is related to how much virus you were exposed to. It's possible it's related to how your immune system it was conditioned, or has been exposed to a similar but not the same virus previously. There's a million different possibilities. We don't know which one is true, but we do know that it affects different people very differently.
Right. So, for the most part, and correct me if I'm wrong in saying this, for the most part, even people who get the coronavirus, the majority of people are going to be fine. In terms of like they're not going to die. Is that a fair statement?
Absolutely.
Yeah.
There's been a lot of discussion about what the case fatality rate is, or what the percentage of people who get the virus end up dying, and it's low. Either way you slice it, it's going to be less than 3%, probably less than 2%, maybe even less than 1%.
Right.
So it's low. If you look at it as a gross, as a kind of a global, from a global perspective. So
Right.
99%, maybe 97, maybe even up to 99% of people, maybe even 99.2 or 5% of people are going to live after having this
Right.
virus. But a whole bunch
Yeah.
of them are going to suffer a whole lot. And up to 15 to 20% of people, maybe once we know more information, it might be lower. So maybe 10% of people who get the virus may have to be hospitalized. And of those, a percentage are going to have to go to the ICU. And of those, a percentage are going to die.
Right. So having established that, right? So like knowing that like the majority of people are going to be fine, and before we start talking about cures, is at which point you know should people start thinking of going to the ER or going to or calling their doctors, like at what level of illness should people start getting worried of this? Like if I have if I have some sniffles, I don't think maybe it's coronavirus, but that doesn't mean I have to run to the doctor. So like at what level do you recommend people start driving their doctors crazy?
So let's just step back for a second.
Yeah.
And once you have the symptoms, even if it's very mild, a month ago I would have said just stay at home and do nothing and just wait it out. Obviously, take precautions, put a mask on, isolate yourself, and so on. But now I would say actually you should try to get tested. And the reason I say that is because as we're starting to make testing more widely available, testing people who have symptoms is incredibly important because it allows you to then trace everyone they have been in contact with, isolate them to really try to prevent the spread. And so you should, once you develop any kind of symptoms, you should make an effort to get tested. And the way to do that would be you could contact your regular doctor who might be able to offer that. You could contact your local public health department. You can, there are a variety of ways to, you can go through drive-through test centers that are set up in many neighborhoods and regions now.
Right.
So once you have a test, if it's positive, great, from the sense that you now have a diagnosis and you know what's going on.
Right.
But even if it's negative or normal, it still doesn't mean that you don't have the virus. It could simply not have picked it up. And going back to that Chinese study that you mentioned, what they did was they compared CAT scans to test results. And in fact, in the early days of having the virus, about 20, 30, sometimes up to 40% of patients did not have, they had an abnormal CAT scan, but they did not have a positive test. So that tells us that the test doesn't always pick up the virus, especially early in the process. So, okay, get tested. Now, where do you go from there? Most patients are going to be fine just staying at home. You can just care for yourself. Like if you had the flu, you stay hydrated, you make sure you can eat and drink.
Including taking over the counter like things for your symptoms, right? That's
Yes, you can take Tylenol for the fever. You can
right.
take medicine for your cough. You can take decongestants for decongesting your nose so you can
Right.
breathe better and feel better. And in some
Right.
cases, you may even, under the direction, if you have a physician that you can speak to by phone or by video, they may be able to give you additional medications, even oxygen, for you to help you stay at home.
Right.
The next question is, when do you escalate? And Luza, like you said, when do you escalate and seek more advanced care? When do you think I'm not doing so well at home, I need to go to the hospital?
Yeah.
So when you're having trouble breathing, if you're struggling to breathe, if you can't get up out of bed, if you can barely walk a couple of steps to your bathroom, to your kitchen, those should be signs that you need to go to the hospital. If you can't eat and drink, if you have severe chest pain, abdominal pain, severe headache or neck pain or stiffness, those are all things that should prompt you to go to the hospital.
Right. Okay.
So Volvi, we all know so much about the virus. We think we know, but there's also something about seeing it. And you are in the hospital in the emergency room, and you see all of these people coming in. Can you explain a little bit about what it looks like, what the virus does to your body?
Well, so the most obvious thing and the most impressive thing that hits you as a clinician seeing this is how rapidly it it can worsen patients' breathing. So the again, the thing that hits you is the fact that you have young, healthy people coming in, just sitting there struggling to breathe. And now it doesn't happen from minute to minute. This thing does advance. It's not like somebody's well, on Monday morning and by Monday afternoon they're on a ventilator. Usually it does take a few days where you're getting sick, you're getting a fever, you're having more trouble breathing. And over the course of sometimes even a week, your breathing worsens to the point where you really are struggling and you need to be in the hospital, get oxygen, in some cases, additional support to breathe. But to see young, healthy people be just laid down by this virus has really been shocking, and also to see the volume of patients, to see an entire emergency department filled with beds with patients coughing and struggling to breathe, is just something that, well, this country hasn't experienced in 100 years. So it really does floor you when you see it.
Yeah, would you say what it does to your body, the result, what the virus leaves over, or what does it do while it's happening? I remember you explained to me about how it's not only the problem isn't only the virus affecting your lungs, it's also the rest of your body trying to cure and being I don't know how. I mean, you'll do a better job and explaining that, like everything overworking, all of the organs overworking, and like what's happening.
Right. So the truth is we don't understand it fully, and there's lots that we're learning every day about the what it does to the body. Primarily, we think that it causes a tremendous amount of inflammation. So the virus obviously triggers the immune system, which tries to fight back, and in this in the it, so both the pathways and the cascade of effects that the virus activates, as well as when the immune system is trying to fight back, both of those processes end up causing a tremendous amount of inflammation in the body. And this ends up causing a number of downstream effects. Of course, the most prominent one is the one we talked about, which is the trouble breathing. And that happens because your lungs become inflamed. And where normally you have a very thin sac that allows you to breathe, and the oxygen crosses that sac and goes into the body, and the carbon dioxide comes out of it. So
Right.
when that little sac becomes inflamed, it gets full of fluid, and that oxygen exchange can't happen.
Right.
So, so that's the thing that ends up killing most people, and that's the reason why most people end up in the hospital, because they have trouble breathing because of that inflammation in the lungs. But that inflammation can also affect your blood vessels. It can affect and cause blood clots and cause your fluid essentially to leak out of you. It can cause your kidneys to shut down. It can cause brain inflammation. It can cause essentially every organ can be affected by that uh, cascade of effects, and a lot of it we don't understand yet. So for example, um, there has been a recent report in the last couple of weeks of all these kids who are getting what's called toxic shock syndrome, or something called Kawasaki syndrome.
Yeah.
We don't understand exactly how it happens, but that is also a type of inflammatory syndrome. So inflammation caused by both the virus, directly or indirectly by activating the person's immune system, is probably what underlies most of what is affecting the body.
Right. So again, to point out that most people, and hopefully fewer and fewer people, will get to this point in the illness. What is the treatment that is available now for these symptoms? And I know we don't have like a cure, but what do you how do you treat patients with severe coronavirus, whether that's drugs or other procedures? What is available basically? What are the tools available to save people in that condition?
So largely for viral illnesses, we generally do what's called supportive care, which means we don't have medications that will directly attack the virus, and we simply aim to support the body as it's fighting the virus and as it's going through this process of inflammation and then recovery. And that's not true for every virus. We do have treatment for something like HIV. We do have treatment for the flu, although it's not very effective. So with this virus, we also started with the same paradigm. We started with largely supportive care, which means if someone is having trouble getting oxygen in their body because of inflamed lungs, you give them oxygen. If they're having trouble with their kidneys, if their kidneys are not working, you give them, if their kidneys are truly failing completely, you put them on dialysis, and so on and so forth. So you do supportive care. Now, we are experimenting, and when I say experimenting, I don't mean to sound this, just to make it sound in a very, I don't know, conducting secret experiments on patients. We're
Yeah,
studying a variety of treatments that could work. There is no single treatment that we have found that really reverses the effects, that somehow cures patient or even treats them dramatically. We simply
right.
haven't found one. Even the studies that have come out that have been somewhat positive have only found mild effects or mild improvements in the disease process. We haven't found the silver bullet. We haven't even found a Brown's bullet or even a bullet made of wood for this virus
Right.
yet.
Right. So I'm wondering. So I wonder how much of the babskerafias. I don't know, what do they call in your house. In my house, they call it babskerafias. What
Babska, is it babushka? Babska?
like baba
Right, right, right. Yeah, I don't remember. I guess it's Babskerafias. Yeah.
I don't know.
So
Kind of like home remedies and the chicken soup stuff and that kind of thing. I wonder how, I mean, it's a little bit a longer question. So I wonder how much of that is effective or in any way, or how much of it is a placebo effect and is it encouraged. But also it's funny because we've all almost forgotten about this doctor in Kiryas Yoel, who was like became like Trump's favorite doctor or some way. Like Rudy Giuliani was interviewing him or something, and there was a whole thing. I forgot his name now. I'm blanking on his name. But he was proclaiming to have some kind of cocktail, and I don't remember if it was hydroxychloroquine with azithromycin or something like that, or maybe his own cocktail, and he was claiming to cure a bunch of people. So I know a lot of people will feel like lumping these two questions together is not fair. Um, so if it's not fair, I wonder whether you think it's fair to ask that question together.
yeah, I think I would separate the two.
Okay.
One is home remedies or folk remedies,
Yeah.
and the other is it's a medicinal treatment that
Right.
is approved for certain medical conditions that
Right.
people are promoting for other purposes for to treat coronavirus. So two separate issues.
Okay.
So okay, so home
The first
remedies.
one, so the first one would be something like vitamin C and vitamin D and like that kind of stuff. Yeah.
Right, and even that actually gets into medicinals. So
Okay.
within home remedies, you have a variety of things. You have true home remedies, like remember, not even a remedy. Remember this? There was a video that went around that said that you can diagnose coronavirus by holding your breath.
Ah.
If you can hold it for some amount of time, then you don't have coronavirus, which is of course complete bonkers and was just complete BS. I don't know who came up with that, but it's a nice viral video that was complete
Four
BS.
Pinocchios on that one. Four Pinocchios.
Yes, yes, very
Yeah.
much
Yeah.
an absolute lie.
Okay.
Then you have things like um, if you swish warm water, or if you eat such amount of garlic, or if you swallow, if you gargle with salt water or lemon juice,
Yeah.
that can somehow prevent you from getting the virus. All of that is crap. There's simply no evidence to support any of that.
Okay. So
Now,
basically,
can I sit here and say I have a study that says that that doesn't work? No, because no, that's never been studied and never will be studied.
right.
Well, so I have a question. So if the people do believe in it, is it a placebo effect? And if so, then
You know,
hey, why not? If you believe in it, it might help you.
So it's a good question. Placebo effect is definitely something to think about and to consider, but uh, I would say,
is it possible? Hold on. Is it possible? I'm just. There might there might be people who don't know what a placebo effect is.
right.
So we just like really quickly simply explain that. Yeah.
Sure. So the idea of placebo effect is that even if I give you a cup of water, let's say you have you just banged your foot and it really hurts, and I give you a cup of water and I say, oh, this has a really good medicine to treat your pain in the foot, and you drink the water and you feel better, not because the water had any effect, of course, on the pain in the foot, but because you believed that the water has something that'll help that that you were taking something that will help your pain in the foot, and somehow the way the brain interprets pain, it is effective in treating your pain. Now, this
Okay.
has been shown to be placebo. So that's the placebo effect.
Right.
So the placebo effect has been shown in numerous studies to actually work, and in fact, in most studies of medicines or treatments, there is a marked placebo effect. So if you take let's say 300 people, you divide them up into three groups, and you're studying, oh, I don't know, you're studying if Tylenol can cure cancer, let's say, which of course it can't. So you take 300 people with cancer, and you give one group Tylenol, you give the other group a pill, but it's just a powder; it has nothing in it, and you give the third group nothing.
Right.
Um, and I actually, sorry, I'm not setting this up right. So if you get three groups, you're studying a cure for cancer. You're giving one group the actual cure for cancer, let's say.
Right.
You're giving the other group a pill, but it's just a sugar pill, and the third
Yep.
group gets nothing. In many studies, they will see that the second group that's getting a sugar pill is doing better than the group that got nothing. And of
Yep.
course, if the treatment worked, then you would assume that the first group would actually see a higher effect than the placebo effect.
Right.
So, so could the placebo effect somehow cause you for a home remedy to actually work? I can't say that it won't. Having said that, there's a limit to placebo effect, and while it can treat things like pain and psychological issues such as depression,
Right.
I don't think it is very effective at treating things like cancer or germs and bacteria and viruses.
You wouldn't recommend it for a broken foot. You know.
No. If you
Yeah.
want to take
Yeah.
it for the pain of a broken foot, yes. But to
Yes. Yeah.
fix a broken foot, no.
Right. Yeah. Okay. Um. So. So what about the second part of that question um
Right.
on the
So, and I just
medicinal?
want to, yeah, while we're talking about home remedies, though, I do want to mention a few others in case people have come across them. And just to be able to tell you, please don't do this at home. Don't take silver. Don't take really high doses of vitamins because they can actually cause bad effects, bad side effects. Don't drink bleach,
Yeah.
despite what certain people might tell you.
Yeah.
Don't even wash yourself with bleach. You do not need to do that. Soap and water is all you need. So that covers, I think, many of the home remedies that I've come across.
Yeah. And don't try to buy hydroxychloroquine on the dark web.
So we'll talk about the medicinal remedies in a second. But oh,
Yeah.
one more thing:
Yeah.
don't use UV light on yourself.
Right.
You can burn yourself. You can get yourself cancer in the long term, and it's not any better than simply using soap and water on whatever part of your body you want to wash.
Right. You do not need to you don't need to basically bleach yourself. This is not. You don't need to like disinfect your entire body, basically.
No, and don't, yeah, so despite what Gwyneth Paltrow might have you do, don't put bleach into your bathtub. Or I think it's Chris Cuomo's wife, whoever does that.
Yeah. Okay. So now to the medicinal part of it.
Right.
Yeah.
So from the beginning of when this hit in China, and it, of course, more prominent in our faces once it hit in our country,
Yeah.
there have been hundreds of remedies that have been medicinal remedies or things that have been studied or thought about, not necessarily formally studied, to potentially treat the coronavirus patients. The hydroxychloroquine idea started pretty early, and I believe it started in China, with the idea that it started. It has a long or it has a background in terms of there were studies of what the coronavirus cell, and they were studying a variety of the virus, and they were studying a variety of potential um, current medicines out on the market whose structure would potentially attack the the virus and
Right.
either block it or actually attack it and
Not,
kill it.
not just the symptoms, but the actual thing that kills the actual thing.
Right. So that's one thing, and then the other idea is to try to give people a medicine that might block the inflammation or might slow down the body's response and inflammatory response. So those were the two kind of pathways that people were following, and hydroxychloroquine was one of the first drugs that people started studying on this, and it started by this. I think the first study that at least was published in the English language literature was a French physician, an infectious disease physician, who published a study with very few patients, something like 36 patients, a very poorly conducted study that showed that maybe this has an effect on decreasing the viral load in the patient, but we didn't know. But so I don't want to get into the details of the studies, but that's how
Right.
it started. And then you had this guy in Yoel who decided to make a video about it, and then of course the man with the most powerful microphone in the country decided to jump on the bandwagon, and off we went.
Right.
And I can tell you, in most U.S. hospitals, all the patients who are really sick got this medicine.
Right.
And all the patients who were really sick got the other, got the zinc and the thing and all this
Right.
stuff, none of which were studied, and
Right.
all of which, now that we have started getting proper studies on it, are seemingly killing more patients than helping them.
Right.
So that medicine, there's a variety of other medications that have been proposed, none of which have panned out at this time to help patients, except for maybe this one drug called remdesivir, which showed in one study only potentially some good signs of shortening the symptoms of the virus, although it didn't help reduce the number of people who died. So in short, I'm sorry that it's really not great news. We don't have great treatments yet. We are studying a variety of drugs, but we don't have a good treatment yet for it.
Right. I wonder. So, like, we as the public, we obviously don't have access to the information that you have in the medical community. But I wonder, how often are you like? Do you wake up every morning and you like open your emails and there's an update and guidance for doctors? And where does this guidance come from? How often does it come? Like how quickly are you updated on what medical advances are being made in this, and where does that information come from?
So in most physicians, I should say most clinicians. I don't want to be excluding other types of clinicians. So most clinicians, who certainly the ones who practice in hospitals,
Yeah.
when it comes to this type of pandemic, you're right. It's very difficult to keep up with what's going on, even as a clinician, especially if you're working a lot. you are simply on the front lines, you don't have time to actually go through and sift through the medical literature. So what happens in most hospitals and in most specialties is that a society, a hospital committee will develop guidelines, and they will sift through all the literature and all the studies, and they will come up with guidelines. And that's what's happened in most hospitals in this country, that they develop guidelines, and they essentially both, so the guidelines have both kind of general knowledge, general information about what the virus is, what you do with patients, and then you have specific algorithms that guide you through caring for this new type of thing, and those are constantly updated based on the latest information.
Right. Okay.
For the layperson, and there's a variety of folks in our specialty and folks in other specialties have been putting together kind of daily updates of all the new things that are going on and all the new information that's coming out. And actually, we were talking about earlier about the early days of the virus, and
Yeah.
I can tell you, going back, in my email inbox, in the early days of the virus, we would pass around, almost like passing around, oh, here's a good pshetl, a good vart, right? These doctors in China and in Italy and in Seattle, where the first outbreak was in the US, they would create these little cheat sheets, and we would all pass it around by email to each other. So
Wow.
and this is how literally we learned from doctor's mouth to doctor's mouth, so to speak.
Wow.
And just teach each other, this is what the virus does to people. This is what you can look for. Look for the white count to be normal, but the lymphocyte count to be low. Look for their CAT scan to show this. Look for their, blood tests to show that. And that's how we learned initially about the virus. And then we slowly,
there's something so chaotic yet so beautiful about that.
No.
Yeah.
It's
like
it kind of
a little scary. It sounds a little scary that is what you were relying on, but at the same time, it's like, oh my God, there are all these people who are just like, sharing all this. It's like this. I don't know. There's something very, very communal and beautiful about it.
It's interesting
and humane.
Sorry, Malky. Yeah.
No, it's very humane. Suddenly,
It's it's very interesting. It was. I think it's thinking about it. It's a fascinating mix of the old and the new. So in the old days, the way doctors would share knowledge is by writing letters, and there were still journals, but they would also publish books of their letters. So a prominent physician would publish a book of letters that would have responses to a variety of maladies. So kind of like shalas or chivas, what we have.
Right.
They would have the same thing in medicine, and that's how doctors would share knowledge. Even going back to 18 and 1900s, in the early 1900s, before science really came to medicine, medicine was very much a knowledge, a base of anecdotes. So Dr. Smith would write to the journal and say, I saw this patient with such and such symptoms, and I think it was that, and it was that, and this is what I did to treat the patient, and that's what you should do as well.
Yeah.
And that's how, so that's the old. And then we come to the current world of medicine, where people share, they do large studies and they publish the studies, and the studies are peer reviewed. And now we went back to the age of old, where people share anecdotes, but we're using new technology to do it. We're using email. We're using video conferences with Chinese doctors to learn more about the virus. It was a fascinating mix of the old and the new.
Yeah, it's so fascinating. So interesting.
That's incredible. So speaking about being human, sometimes for regular people, and I'll speak for myself, when I speak of a doctor or a scientist, I think, okay, they know everything, and therefore I don't need to know nothing because they will take care of me. But I'm wondering, so what about doctors getting infected? Like one day you're called into an extra shift because your colleague has the flu, and how what makes you step into the danger and do what you're doing?
Well, you do it because that's what you were trained to do, and it is scary. It is very scary to be faced with a person who is your own age, maybe even your colleague in many cases, and having to take care of them. And you see your own you recognize your own fallibility, your own vulnerabilities. But you do it because it's, medicine, as much as it's become a business, it's still a mission. And most people, nearly all people I know, who have gone into medicine didn't do it simply because they wanted to make a lot of money. They did it because they loved medicine and they wanted to care for people. So that's why you do it. That's how you go in. And I guess it's kind of like the military as well. You go in because you want to be there for your colleagues and you want to be there for your buddies.
Right.
So it's both to care for patients, to care for your colleagues and your fellow staff. It was really it's an incredible feeling actually to walk in, and people who you generally wouldn't talk to, everybody kind of nods to each other, waves to each other, smiles at
Yeah.
each other, because we're all feeling under attack. We all feel vulnerable,
Yeah.
but we still at the same time feel like we're doing this as a team.
Right. I mean, I want to. Sorry, Malky, go ahead.
I'm saying thank you for that.
Yes, thank you for that. And now I was going to ask you, as more as a friend, like, do you guys, like, you personally, do you guys have enough PPE, like personal protective equipment, like masks and shields and those garbage bag kind of clothes and all that? Like, do you personally, like, does your hospital have enough? And what are you doing personally? Like, what extra steps are you taking every day when you go in, to make sure that you're safe?
So we do now have enough PPE, but it's been a struggle. Like the rest of the country, we had times when we had imminent shortages. I can say that I've never had to take care of a patient without having the appropriate PPE in the hospitals that I've worked at. But we've had to constantly adjust, and this is true for all health systems. And the CDC has, we've all, as public health officials, as scientists, as physicians, we've all been adjusting constantly to the latest studies and latest science and how the virus spreads and how we can prevent it spread. So initially, we thought that we'd be safe just by wearing a surgical mask when not directly caring for patients, for example, or caring for most patients, or if you stay just X feet away. But as we became more and more aware of the additional studies on the transmission of it and how contagious it is, we've had to essentially amp up the protection that we wear. So large shields and gowns and covering your head, covering your shoes in some cases, wearing different shoes. So what I do is I you follow the protocol that the hospital has in terms of you wear goggles or a face shield with every patient, and even patients who don't have obvious symptoms. You always wear a mask. We wear N95 masks throughout our shifts.
Yeah.
We wear gowns and so on. And then at the end of the shift, most of us are now trying to change our clothes, sometimes before you leave the hospital, but in many cases before you enter your home. And essentially, you immediately run to the shower after you come home and try to get rid of any aerosols or particles you may have had in your hair or on your neck or any area that wasn't protected.
Right. So, I mean,
And I'll just say, so one more thing. I have a lot of colleagues who have actually, and friends and classmates from training, who have been staying in hotels between shifts. They're staying away from a family because they don't want to infect them. Absolutely.
Wow.
Which is an incredible sacrifice.
Yeah.
Wow.
Yeah, it's really I mean, these are interesting times, to say the least. It's not something that any of us have seen before. I was gonna ask, so now as people start going outside, whether that's a good idea or not is a whole different conversation, obviously. But the fact is that it's happening, and municipalities are working on a local level. They're making up the rules as they please. Like, for example, in California, like, a lot of the state is opening up. Same in New York, a lot of the state is opening up, but the cities like LA and New York City, are not opening up. But in other places, people are starting to go out. So, what kind of preventative measures should, like, on a personal level, forget about the fact that this whole thing is a communal thing, that it's something we have to do together to get through this. Um, but what should everyone do when they go outside, if they go outside, as to keep everyone safe?
I think the public health officials are giving good advice, and you should wear a mask. You should stay the recommendation. What is it? 6 feet away from other people as much as possible. Don't shake hands. Don't do anything that gets you in close contact with someone.
Mm,
Don't touch anything. If you're going to
Mm.
shop, then don't wear gloves. Don't wear
mm,
gloves anywhere. Stop. I see people wearing gloves when they're driving. I see people wearing gloves outside on the street. You really should. There's
yeah,
no point in doing that. Uh, if you touch something, just don't touch your face. Don't touch anything. Wash it off with hand sanitizer, or sorry, use hand sanitizer, or wash it off with soap and water.
yeah,
If you are coughing, well, if you are sick, don't go outside. If you
right,
cough or sneeze, do it in your elbow, or even better, just lift up your shirt and just do it inside your shirt. That's probably even better than coughing in your elbow.
right. Yeah, because the virus lives longer on skin than it does on like cloth, right?
Well, the it's in terms of infecting other people, it's more about where the particles are going. So if you're coughing into your elbow, you're redirecting a nice amount of them, but you're still doing a whole bunch of spraying of
Right.
aerosolized virus potentially. If you cough into your shirt, which I prefer for
Yeah.
people to do, it all goes into your shirt.
Right. And then the next thing you know, you got to get a new shirt. Huh? What do you know?
Well, that's what a washing machine is for.
um. So. So. How do you how do you see the future? Like, I know we're like still in like this really weird stage where we're not at the beginning of the pandemic. We're not at the beginning of the discovery of this whole thing, but we're not really in the middle. We're not really at the end. We don't really know where we are. I think at this point, there's still a lot of uncertainty. But how do you see the future? As a clinician.
So my crystal ball is as clear as honestly the next person, and I don't really have any more inside information than what you see out in from the CDC, from Dr. Fauci's and Birx and the other public health experts. It seems like we will have a simmering viral transmission throughout the summer. So you'll have a constant stream, but a much, much, much lower number of patients coming in, getting sick throughout the summer, and likely in the fall and the winter, along with the flu season, it appears most public health experts think that that's when we'll have a resurgence of the virus,
Right.
especially if we go on with life not as usual, even with the modified coronavirus life. So that's what we think is going on. That's what people think might is going to happen, and the end game is essentially with a vaccine. But it's not just with having a vaccine; it's a vaccine that everyone gets. So if half the country decides that they're going to believe in conspiracy theories and not use the
Yeah.
vaccine, then we're basically back to square one.
Yeah. Yeah.
So the
Yeah. I
end game is,
only.
of course, either a vaccine or if essentially 80 to 90% of the population gets the virus, which is something that would be horrifying because that means that a tremendous number of additional people are going to die.
Yeah. Yeah. I think yeah, I think I don't know. I feel personally like I think there probably was a point during this pandemic where people felt, or at least that thought passed through their mind of like, what, let's just let this run wild, and create like what herd immunity or whatever. And then immediately when you realize what the numbers would be and what would happen if we let that happen, we all, like this, that's we all realize it's a terrible idea. So I think that most of us are past the point of suggesting that, and everyone is just like trying to find, some kind of middle ground in all this, in a way where it doesn't like completely destroy the entire country. But
Absolutely. I think saying simply "let it run wild" was the most irresponsible thing I've ever heard people say. Because if
yeah,
you had spent a minute in a hospital, an emergency room, if you had spent a minute in an ICU that had two patients in a room because we didn't have enough ICU rooms, that had two ventilators, two patients on the same ventilator, which thankfully the hospitals that I work at never had to do that. But in some places, they had to do that for short periods of time until they got additional ventilators. If you saw that, you would never ever think that that's a good idea. Now, that doesn't mean, I think we need to point out that shutting the country down like we have has a tremendous effect on people and even kills people.
yeah,
So it's definitely a fine balancing act, and there is a middle ground that you can take between letting things run wild and having a very socially distant culture with isolated lockdown, with more restricted lockdowns around outbreaks and so on and so forth, that could potentially mitigate and save a lot of people's lives, instead of this idea to quote unquote let things run wild.
right, right. So, like, yeah, so most people, again, like, we can't let it run wild, and which brings me to another question, that even though most people are going to be fine, there are people who are considered immunocompromised, or people who are at greater risk of dying, or having like much more severe symptoms requiring hospitalization. Can you explain what is who is immunocompromised, and who are these people who are at greater risk? Because I keep hearing, even though I'm a pretty like informed citizen, there's just that list seems either endless or too short or too long. It never makes any sense. Is it like people with diabetes? Is it people with this? Give us the gist of who should be more careful.
So immunocompromised means a person whose immune system is not working as well as a normal person's immune system. An example of that could be someone who is taking chemotherapy for cancer or other
Right,
type of condition. The chemotherapy, the effect of it is essentially it destroys cancer cells, but it also destroys the cells that protect you from infections. Someone
right,
who's taking a medication for certain conditions like multiple sclerosis or lupus and so on, those people can also have suppressed immunosystems,
right.
and that's called immunosuppression.
Okay,
So what happens is when when any virus or any bacteria hits your body, the immune system recognizes it and in most cases fights it off. If your
right,
immune system is not functioning as it should, it obviously can't fight it off. And on the one hand, in many cases, you might actually be better off. This is in some cases where people have their own immune system reacting and attacking their own body, but in most cases it's a big problem, and you have no defenses essentially.
right,
Um, the other problem, of course, is that if you have no immune system or a not functioning immune system, you may get the virus and maybe you have a very mild illness, but you actually are not building up any immunity to it. And in fact, I saw a patient the other day in the emergency department who had coronavirus 2 months ago, and guess what? She has coronavirus again now, or she has COVID
wow,
19 again because she never developed any immunity to it. And we don't know whether other people develop immunity. That's still a question, but she definitely did not develop immunity, and likely because she has no immune system because she's on chemotherapy.
right,
So other people who have immune systems that don't work as well includes people who have diabetes. Uh, Diabetes has a variety of effects on the body, and one of them is also that their body can't fight infections as well. It's a bunch of complicated physiology about why that's the case, but that is the case. Uh, Obviously, older people are more prone to a variety of illnesses, and infection is one of them. As you age, your immune system simply is not as effective as it used to be at fighting infections. And in addition, your body is generally not as resilient. So when something hits it, when your kidneys don't work great, when you're not breathing great, everything gets affected faster than it would, and faster and more significantly than it would affect you if you were a young person. So those are a sampling of people who are at higher risk if they were to get infected with COVID-19.
Right. All right. Last question. Not last question. No, there's one more question. Malki has a question after this. But I was wondering if there's a, considering that at least from my generation of OTD people, you are like the doctor. Have you noticed any specific OTD related questions or issues regarding the coronavirus that you found yourself answering, like specifically from people who are OTD, or is there something that we haven't asked, or like that you haven't been asked that you wonder why you haven't been asked, or is there something that that we as Ashkenazim or ex-Hasidim or anything specific that you want to say, you want to address?
Nothing comes to mind specifically. People who are in the community who are OTD generally have the same type of physiology that everyone else has. So I've been fielding questions from friends, from family, with COVID-19. So, and it's pretty much affecting them like it's affecting everyone else. And I think that's an important thing to point out, because there are people who question the need for social distancing. There are people who question the advice that you hear from public health experts, and there are people who question that that the medical world, that the doctors and nurses don't have their best interest in mind. And I think that's one thing I really want to push back on. This idea that somehow the hospital doesn't care about you, or the hospital just wants to treat other people and not you. I think that's
there were a bunch of rumors.
patently.
There was actually a bunch of rumors back in the early days about like Hatzalah not taking patients to Maimonides, or there was something going on in Maimonides. So yeah, there was a lot of what you were saying, but there was also just a bunch of conspiracies. But anyway, go on. Sorry.
I really want to push back against that. And in fact, that specifically, I have a lot of friends and colleagues who work at Maimonides, and they in fact have been leading the some of the research on COVID-19, but also they have been leading in figuring out how to treat COVID-19. And people were talking about, oh, they're just going to put you on a breathing machine, on a ventilator, and kill you. In fact, the doctors in the Maimonides ER are the ones who were spreading the word early than anyone else, or earlier than most other people in medicine, that stop putting people on ventilators because it can actually make things worse for some patients.
Right.
So this idea that doctors don't care about you, this idea that patients are plopped in a bed and ignored for hours, is completely untrue. And yes, we couldn't let you in the hospital. We couldn't let visitors in the hospital because we simply didn't have enough resources, and because we were afraid that you were going to bring it in, you were going to bring in the virus, and that was completely the right thing to do, and still is the right thing to do for the most part. It is not because we're hiding something. If you had seen, and I think you can see from all the videos that doctors and nurses have been taking, if you see the dedication, the amount of care, the amount of risk that everybody who works in a hospital has been taking to care for people in the hospital, you would never even think of, even for a second, of believing such silly conspiracy theories.
Yeah. All right, Malki, you wanted to.
So I have I guess a final question for all of us people at home. What would be your advice? I'm not just saying at home, but to move ahead. What would your advice be to stay healthy and take self-care. Like some people say vitamin C, some people say other things. What would you say? What would your advice as a doctor be to all of us who haven't gotten it yet, or might have and have been past, but these days?
So there is no single thing that you can do to prevent getting the virus other than the social distancing and hygiene advice that the CDC and other public health experts have been giving us for the last 2 months. Social distance, wash your hands, wash your hands, wash your hands. Don't touch anything, don't touch anyone. And certainly don't be next to someone who is sick or coughing or sneezing. In terms of other than that, keep yourself healthy. Because when you do get the virus, you want your body to be in the best shape possible. So eat healthy, exercise,
and stop smoking.
and stop. Yes, absolutely. Stop smoking. Don't drink so much, and so on and so forth. Keep your body in the best shape possible, because when it hits, you want to be one of the luckier ones.
Are people who are gemalet less likely to get COVID-19?
Well, that's a good one. I would say, so I'll say this. I haven't heard. That's a really good question. Actually,
Oh my God, I want it to be a silly question.
No. Pause 1 second. I want to actually look this up.
Okay.
Wait, I have a silly question. Are you allowed to break kabbalah sevichu vesimechu if your mom says you don't have to social distance?
Yes, right. Well, I would say yes, because Pekirch Nefesh doiche kilam, right?
Yeah. Yeah.
Yeah.
So,
Thank
that is a great question. So, I don't. So, we're good. Okay, going back to the Mila question.
Yeah.
They have found. Well, so
Circumcision.
they have found COVID-19 virus in people's semen.
Okay.
But we don't know whether COVID-19 can be sexually transmitted. We simply don't know that. If it can be sexually transmitted, and that's a big if, then theoretically, people who have been circumcised might be at lower risk of getting the virus from a partner. I don't think it would matter. I don't think it would matter in terms of actually infecting someone else. But again, all of this is just hypothesis. I have nothing to base it on other than just a.
You know what that proves, Volvi? That proves that the Toirah knew everything. Everything is in the Torah.
Everything is in Pashas Vayichim.
I'm just gonna say no comment.
As a medical professional, I would not expect you to comment on that. But as a friend and a joke, I would at least expect you to laugh.
Well, that's why this is not a video.
Yeah, I know.
Podcast.
All right, thank you so much.
Thank you.
My pleasure. Anytime, Luther, and stay healthy, stay well, and wash your hands. Take care.
Thank you so much for listening, and thank you to our guest. Oh, and thank you to my wonderful boyfriend, Joseph Horowitz, for not ruining it, by staying quiet this whole time we were
he's so
recording
nice.
the podcast.
He's such a doll.
He's a doll.
And thanks to Gideon for the countless hours he put in recording the intro and editing the podcast, and to Sky Media and Design for the cover art. Thank you so much.